I wanted to talk today about something called thoracic outlet syndrome, which by definition is a compression of the nerves or blood vessels as they exit the side of your neck and travel down through this chest and shoulder region. Symptoms most often are this numbness and tingling in this outside portion of the hand. You can have numbness and tingling a little bit farther up. You can have pain in the neck or the shoulder all the way down the arm. Usually it's the numbness and tingling that we notice first, and usually only in a position where those nerves and blood vessels are compressed. So for example, if the arm is being pulled down, if the arm is reaching up, a lot of us will wake up with numbness and tingling in our hands after we've been sleeping all curled up like this, which is not necessarily thoracic outlet syndrome. It's just been a compression of those nerves and blood vessels while we're in that sleeping position. And there are a couple of things that you can try to relieve it by yourself. So this brachial plexus can become compressed through these neck muscles in the front called your scalenes, so between the anterior and middle scalenes. So we can stretch those to relieve the compression of that neurovascular bundle. And or you can release this pec muscle, your pec minor muscle, which is a little muscle under the big pec major one, or it can become compressed between the first rib and the clavicle, which is a little bit more technical to treat, and you should probably see a manual therapist. If this is something that you want to try to relieve yourself, I will show you the stretches for your neck and your chest to see if we can relieve the compression on those nerves. Okay, so stretching out your scalenes, you can probably see them pretty easily on me because I have these stringy, pretty prominent scalenes. So if we're stretching the right side, and we should always do both, but let's say our symptoms are on the right side, you're getting that numbness and tingling here, you're having pain through the hand or the arm, you want to side bend left ear to left shoulder, and then we're tilting our chin up towards the ceiling like you're trying to look at something behind you, and you should be feeling a pulling down in this section. Does help if you push the shoulder down, and or you can put your arm behind your back to keep that first couple of ribs down, because that's where your scalenes attach, and then come up to the side of your neck here. While you're in a stretch, you might feel an exacerbation of symptoms, so more numbness and tingling, a little bit of increased pain. And that's okay. When we let go, they're going to be looser than before. So same thing on the other side. You want to side bend right ear to right shoulder, and then turn your chin up towards the ceiling, push the shoulder down, and or go ahead and wrap that arm around behind your back. And you want to stay here for 15 to 30 seconds, just breathing nice and slowly into the very base of your stomach, and then come out of it slowly. If you have neck pain while you're doing it, either don't do the stretch altogether or just come out of it a little bit. So if here you're fine and here you're fine, but doing this is too much, then don't do that part. Just give it a gentle push down, but find your happy medium. Okay, so showing you the stretch for your pec minor muscle, which is a small muscle under the big pec major. And we stretch it almost the same way, but just at a slightly different angle. So you want to find a doorway, and you're going to put your elbow and your wrist with your forearm fully supported in that door jamb. Find your 90 degrees, and if you want to be extra comprehensive, you can do both. This will stretch your pec major muscle, which a lot of us need because we have these like real rounded shoulders. So for bonus, do it at the 90-degree mark. But if you're just looking to target that pec minor muscle, which can compress that brachial plexus, you want to angle it up another 45 degrees. So you're coming up there. I like to come into a lunge position. I like to put my right foot forward, so the opposite side, and keeping my arm stable and secure here. I'm just going to gently lunge forward and bring my chest further, but my shoulder stays back here. I'm getting a nice lengthening sensation through here. Again, you might feel that numbness and tingling increase while you're here. It's totally fine. That means we're on the right spot. Just stay here for 30 seconds, nice slow deep breaths, and then come out of it slowly. And again, I would always do the other side. So same thing, left foot comes forward, right forearm supported on the door. Nice tall spine. And just lunge forward until you feel your happy medium. So you want to go as far as you comfortably can. Shouldn't be painful. You should be able to stay here for at least 30 seconds. If it's too much, then just bring your body back a little bit. But all you need to feel is a pulling sensation. As long as you're feeling like a soft tissue stretch there, then you're good to go.